Sorry, we're welcome everyone. Great to see everyone out there. We continue to be physically distanced, but socially connecting in this way, and urge you to continue to try to connect in your neighborhoods and reach out to people near and far to make sure that they're okay, that they're staying well during the pandemic. So I'm excited today to bring you an interesting topic that's a little outside the box. I have the pleasure of running our VA Center of Excellence here in the Southwest. And as part of that, we're part of a larger network of VAs taking care of veterans across the United States. And it's my pleasure to work with Jim Morley. Dr. Morley has become a friend and a colleague, and we've worked together on a number of projects over the years, throughout the VA network, but he's really had a passion for working around exercise and trying to motivate not only veterans locally, but all people living with Parkinson's to help them to exercise and stay fit as part of their wellness. Because I think Jim will tell you that exercise is medicine to us physicians who love this field and are passionate about taking care of patients. So we have an extra special guest as well that I'll let Jim tell us about in a minute. So Jim has had an interesting career path. He's studied all over, and he started in business school at Wharton, and then went to Northwestern and spent time getting an MD and a PhD, and now he's at Penn, and he's largely based at the Philadelphia VA. Jim, tell us a little bit about your sort of path to becoming a Parkinson's doctor, and then your passion and how it's grown in exercise and motivation. Oh, I think you're
myself.
Okay,
there we go. Perfect. Okay. Indu, thanks so much for the introduction. Thanks for having me. This is great. I'm glad to see such a great turnout. I'm glad to see enthusiasm for this topic, because I certainly have a lot of enthusiasm myself. As far as my path, I think I did sort of take a little bit of a circuitous route. Once upon a time, I was a scientist working on sort of the basic biology of neurodegenerative disease and giving Huntington's disease to little teeny tiny worms and trying to understand the pathophysiology. But in the course of that, realized it was a little bit further than I wanted to be from patients, and became interested in patient care. My interests in science were in neurology and the brain, and so that led me naturally to neurology. And within neurology, I think Parkinson's disease and movement disorders has a special place in that we have some medications that can really help people, and B, I think the most attractive thing was the ability to build long-term relationships with patients over the course of many, many years. And so that's what attracted me to it. That's what's kept me in it, and it's been very satisfying. As far as exercise is something I'm very interested in my own life. I became interested in it as sort of a therapy for Parkinson's, and that's a piece of what we do. We have a study ongoing to look at the effects of exercise on symptoms in Parkinson's disease and long-term disease progression. But what became clear to me over time was that we can, prove that exercise is an efficacious therapy in a clinical trial, but if we can't get people to exercise at home and integrate that into their lives, it has no chance of being effective. And so that piece of it is probably as important, if not more important, than demonstrating that exercise works. And I'll talk a bit about that in my slides.
That's awesome. And we'll meet your special guest, I guess, after we go through your slides.
Yes, absolutely.
Okay, awesome. Well, we look forward to hearing maybe your slide presentation, and then we definitely do want to take questions and make it a bit interactive. Maybe while we're listening to your slides, we can also maybe see in the audience what people's favorite exercise is, if you want to type it in the chat.
Absolutely, and I have at the end of my slides sort of a set of questions for the audience, but I'll kind of ask them now. Just what motivates people to exercise, what keeps them from exercising, if they have these barriers, how have they learned to overcome them, and what could your providers do to make it easier to help you overcome those barriers. So those are sort of some of the things that I'm very interested in learning too. And I'll kind of go through these slides as quickly as I can so that we have plenty of time for questions. Yeah,
no worries. We're excited. Thank you.
Okay, great. All right, so I will start sharing. All right, can you guys see?
Yep, I think you just put on slide if you like. We can see your.
All right, put it on there.
Perfect.
Okay,
yep.
Great. All right, so I think we sort of introduced the heck out of this. So I'm going to talk about exercise, but I'm going to sort of in the larger sense of motivation and self-care in Parkinson's disease, and how that's kind of a shift in focus. As a provider, I can diagnose and prescribe therapies, but this is a shift in focus to, to paraphrase JFK, ask not what your provider can do for you, but what you can do for yourself. And these are, exercise is one of these things, but other lifestyle interventions like controlling your diet, your sleep, stress reduction using mindfulness and other methodologies really requires self-agency. It requires, patients to participate in their own care, and I think can be incredibly beneficial. It can be incredibly beneficial, but obviously easier said than done. And we'll talk about, a bit about why that is. And this is really kind of an unexplored, I think, therapeutic area. And I think it's worth taking a look at. I'll talk about it through the lens of exercise today. And then as Indu alluded to, we have a special guest, a patient and friend of mine. Lift this out of the wall, excuse me. Patient and friend, Mr. John Creveling, who's been kind enough to join us, who has had Parkinson's disease for a number of years, been a patient in our clinic, and I've had the pleasure to getting to know, and is really just sort of a poster child for how one can adapt some of these principles of sort of, self-agency, self-efficacy, feeling like you want to, be part of the care of your disease, and how that's really made, I think, a terrific impact for him. So I'll look forward to hearing him talk about that a little later. Okay, so exercise, and Indu alluded to that, we think of it as medicine, and in particular, it's brain medicine. We all know about the general health benefits, but there's a lot of evidence that exercise is good for your brain in particular. So for instance, if you look at large populations of people, and you look at the relationship between their physical fitness and their scores on cognitive tests of thinking and memory, people who are more fit tend to do better on those sorts of things. People who exercise in middle age to and in adulthood have a lower risk of developing cognitive impairment and dementia. And if you look at the brains of those people on an MRI, it's because the people who exercise more tend to have more connectivity between different areas of the brain. We also can look at animal models, which are not exactly the same as people, but can tell us a lot more about the mechanisms. And we see that important growth factors that stimulate brain health and growth are elevated by exercise, that markers of synaptic plasticity, or the ability of the brain to kind of change in response to different insults or challenges, and neurogenesis, actually the creation of new neurons, is stimulated by exercise. This is something that's garnered an increasing amount of interest in Parkinson's and beyond. This is just a little chart that shows the number of papers that have been published over time on exercise in Parkinson's disease, and we're now seeing hundreds and hundreds of papers published every year on Parkinson's disease and exercise, which is very exciting. What do we mean by exercise? We mean a lot of things, right? So listed here are just a laundry list of some of the examples of exercise, and we can put them into 4 general categories. So aerobic or endurance exercise, that's more sort of high intensity aerobic type endurance exercise, running, swimming, high intensity interval training. Strength exercises, so some sort of resistance training, whether that's free weights or body weight or resistance bands. We'll talk about how to incorporate different modalities over the course of Parkinson's disease. Flexibility exercises like yoga, or even just sort of static stretching, or balance-based exercises as you might do in physiotherapy or Tai Chi, which is very popular and useful in Parkinson's disease. And obviously there's a lot of overlap between these categories, that you can do flow yoga and have that can be flexibility, but also quite an aerobic workout. And so I'll go back to this slide for a second. So it's great that we have all of these options, because maybe we can find something for everybody, but it makes it very hard to study, because there are, of those hundreds of studies that have come out every year about Parkinson's disease and exercise, they're looking at different exercises, they're looking at different intensities of exercise, they're looking at different outcomes, they're looking at different lengths of the intervention and different periods of follow-up in different populations. So it's a little bit of apples and oranges, and I'm just going to run through real quickly some some data that tries to look at apples and oranges and make them look a little more like apples and apples. And that's what's called a meta-analysis. It's a study of studies where you combine different studies together that are similar enough that you can say, okay, the interventions were all of one kind. So maybe it's different kinds of aerobic exercise, but they're all aerobic. And you try and look at studies where they use similar endpoints. And so in this way, you try and sort of bring the results of those studies together to get a more robust result. So for instance, this is a study that looked at 18 different studies of aerobic exercise in Parkinson's disease with almost 1,000 patients. You can't put 1,000 patients into a clinical trial of exercise. So this is a way to combine them and try and to get a more robust result. This study looked at early to mid Parkinson's disease patients. And as I said, it looked at a bunch of different types of interventions. So treadmill, dance, high intensity interval exercise over a variety of follow-up periods, but all aerobic exercises. So, trying to bring this together. This particular study, fortunately, they all used a similar outcome. This is the UPDRS, or Unified Parkinson's Disease Rating Scale. This is the gold standard for looking at sort of overall motor function in Parkinson's disease. And so, nearly all of the studies that were looked at here used this outcome measure, and you can sort of sum these all together, and you get this big black diamond at the bottom. And the further away that diamond is from the center, the bigger the effect that the intervention had on this particular thing that you're looking at. And so, long story short, it's too late for that. This intervention, so aerobic exercise, has a pretty big effect on overall motor function in Parkinson's disease. And so in this study, they then went on to look at another set of measures in Parkinson's disease, this time focused on gait. And they used a whole bunch of different outcomes that look at gait. You can sort of see that there are fewer numbers of studies here. So it indicates, again, that different studies looked at different outcomes, but we're trying to kind of homogenize them a little bit and get the common message. The common message here was that aerobic exercise was good for nearly all of these. Maybe not as good for overall motor function, but there was a pretty broad effect of aerobic exercise on overall, not only overall motor function, but also on gait and balance measures. This is a different meta-analysis that looked at resistance training or strength training. It looked at a smaller number of studies, but again, several hundred patients all at once. In this study, they looked at, numerous of the studies looked at strength, measures of actual leg strength, and not surprisingly, there was quite a large benefit of resistance training on leg strength. But then when they went ahead and looked at overall motor function, again, the UPDRS down at the bottom, there was some effect, probably not as big as aerobic function. But then when they looked at the balance and walking measures, they were kind of on the edge of being significant. So, maybe beneficial, but maybe not quite as beneficial as aerobic exercise. This is a meta-analysis that looked at some studies examining Tai Chi in Parkinson's disease. Again, looking at 9 different randomized controlled trials, almost 900 patients, largely early stage patients. And again, the take-home message here is that Tai Chi, for example, was pretty good for overall motor function. Again, not as good as aerobic exercise, but was really, really good for balance. So giving us the idea that maybe different types of exercise might target different types of symptoms in Parkinson's disease. And so the upshot of that is that there are multiple exercise interventions that are beneficial in Parkinson's disease, especially for motor symptoms. The different exercise types might target different motor types of symptoms, gait and balance versus overall motor function. But that aerobic exercise might have kind of the broadest range of effects. But there are a large number of questions that remain about how to translate these results from clinical trials into treatment. And we can talk about some of those in the question and answer if you'd like, about what's the best exercise, or how should I exercise, how often, how much, and then how do we get people in these clinical trials? They were they had research coordinators calling them. They had people bringing them in to do exercise on a treadmill. This was only over 3 to 6 weeks, maybe. How do we translate that into getting patients to exercise in their homes and communities to turn this into a real treatment? As far as non-motor symptoms in Parkinson's disease, we don't know quite as much as we do for motor symptoms. There are a couple of reasons for that. Number one, most of these studies used motor outcomes as the primary outcome of the study. Some looked at non-motor symptoms, some studies didn't. But a lot of times in clinical trials like this for an intervention, a lifestyle intervention, it kind of makes sense to not enroll people who have a lot of problems with depression or cognitive impairment. These other non-motor symptoms often are not recruited into these clinical trials, and so we know a little less about the intervention's effects on them because there were low levels of the non-motor symptoms to start with. But what we do know from looking at some of these studies is that there do significant improvements in mood, sleep, particularly cognition. I'll talk just a little bit more about that. And that there's good reason, even though we don't know as much about exercise and non-motor symptoms in Parkinson's disease, there's a very robust literature in just the general population and in the mental health community about the beneficial effects of exercise for things like depression and anxiety. But overall, we need more studies in Parkinson's disease with targeted interventions and targeted outcomes to look at non-motor symptoms. But in practice, when we talk to patients about this, I think of it as a happy side effect of introducing exercise to benefit motor symptoms, is that we're very likely to benefit non-motor symptoms as well. And that's particularly important because while we have good medications like carbidopa-levodopa, dopamine agonists, other drugs to benefit motor symptoms, we're really at much more of a loss for pharmacologic therapies to benefit non-motor symptoms. And non-motor symptoms, as you guys well know, can be as debilitating, if not more so, than the motor symptoms of Parkinson's disease. So non-pharmacologic interventions for non-motor symptoms really are likely to be terribly important. And probably one of the most important and maybe most feared non-motor symptom of Parkinson's disease is cognitive impairment. This is another meta-analysis, systematic review of a variety of exercise programs in people with Parkinson's disease that looked at cognitive function as an outcome. And this particular study, and there are several meta-analyses like this, but this is one example, looking at 9 randomized controlled trials, several hundred people with Parkinson's disease who had cognitive impairment and where cognitive outcome measures, where cognitive outcome measures were looked at. The patients didn't necessarily have significant cognitive impairment. This particular study looked at a variety of exercises, including treadmill, dance, Tai Chi, Wii Fit. Again, so distinct exercises, but all with a focus on cognitive function. The upshot is that there were definitely improvements in cognitive function when you looked at all of these exercises taken together. Not entirely clear whether any one exercise was any better than any of the others, but it's kind of hard to find that with these sorts of studies designed. So it's not impossible that there is one exercise that's better than another, but this is really not kind of the study that's going to show you that because it's limited by how many different kinds of interventions there are and that they're looking at different outcomes. But as I alluded to in one of the earlier slides, there's very good reason to think from the general population that at least vigorous physical exercise can improve cognitive function in the short term and prevent the onset of cognitive dysfunction in the long term. And so this is one of the main motivating factors, I think, to introduce exercise as a therapy throughout the course of Parkinson's disease to improve cognitive function in the short term and perhaps protect against the development of cognitive dysfunction like MCI or dementia in the long term. And so I think the holy grail of treatments in Parkinson's disease is not to improve motor or non-motor symptoms in the short term, but it's really to slow down disease progression, or in a perfect world, even halt disease progression or reverse it. This is referred to as neuroprotection or disease modification. And this is a review from a number of years ago it's been updated a couple of times, but it asks the question of, does exercise, particularly vigorous aerobic exercise, modify disease progression in Parkinson's disease? And there's an increasing body of evidence to suggest that this is likely to be the case. So again, as we saw with dementia, if you look at, there have been a couple of large population studies looking at hundreds of thousands of people who report their midlife exercise habits, so in maybe in their 40s to 60s, and then looked going forward at the risk of their getting Parkinson's disease. And the people with the highest levels of exercise were half as likely to develop Parkinson's disease, and they were likely to get it at later ages if they did get it. So there's good reason to think that vigorous exercise can delay or even prevent Parkinson's disease. And if exercise can delay or prevent the onset of Parkinson's disease, that gives us a pretty good hint that exercise targets something about the progression of Parkinson's disease, and so may be able to slow down progression in people who have Parkinson's. And that's supported by these observations in animal models that neurotrophic growth factors like brain-derived neurotrophic factor and others are elevated by exercise. And in animal models, those neurotrophic factors will slow down or even reverse animal models of Parkinson's disease. And this is not very well studied in Parkinson's disease patients, but a couple of trials that have looked using non-invasive imaging techniques suggest that you can increase the amount of dopamine receptors in the brain by exercising, and that might mean that you can increase the number of dopamine cells in the brain with exercise. Okay, so if we assume that exercise in some form is efficacious, and I sort of introduced these terms a little earlier in the talk. So efficacious just means we did a clinical trial in a controlled setting and we saw a positive effect. But that's really not enough. You can have a therapy that's very efficacious, but if it has terrible side effects or it's really costly or you just can't get it into people's hands, then it'll never be effective. And that's really the way that we have to look at exercise. I think we have increasing, and I would argue kind of enough evidence to convince ourselves that exercise is efficacious. We know for sure it improves motor symptoms. It's probably going to improve non-motor symptoms, and we can hope that it influences disease progression. But we need to turn it into an effective therapy, and that is underlying that is at least two questions. One is, how do we prescribe it to patients like a medication? And then the second is, will patients take it if we prescribe it? I'll talk a little bit about the second question first. So this is some work that we've done. Other people have done similar studies. This is a former fellow of ours, Sneha Mantri, who looked at exercise habits of people with early Parkinson's disease in a very large study called the Parkinson's Progression Marker Initiative, or PPMI, that some of you may be familiar with. And she basically found that the self-reported exercise habits of people with early Parkinson's disease compared to people of the same age or healthy controls was about the same, which is good. But when Sneha went and compared how those self-reported activity levels compared with recommendations from like the American Heart Association, it turned out that only 40% of people with Parkinson's were, and this is just even early Parkinson's disease, were meeting those goals. That more than 50% of patients were reporting that they never did anything for kind of moderate to vigorous exercise. And the other offshot of this is that it's likely that this is going to be worse in other populations. So these were very early Parkinson's disease patients with very mild symptoms. And they're also kind of very motivated by definition. This was a group of people who agreed to be in this long-term study where they did a number of things, not the least of which was to get a spinal tap every 6 months for a couple of years. So maybe not the most representative population. Sneha went on to look at about 75 of our veterans in our PADREC in Philadelphia, and not surprisingly found that their self-reported exercise scores and how compliant they were with recommendations for exercise was dramatically worse than those early PD patients in the PPMI. And other people have, other groups have observed that this amount of self-reported exercise does decline over the course of Parkinson's disease. And Sneha importantly went on to look at what are some of the things that made the people who exercise more, and what kept other people who didn't exercise so much from exercising, because obviously those are the things that we'd like to intervene on in order to get people to exercise more. And so these fell into a couple of different domains. So sort of in a health domain, fear of falling is a big limitation to exercise. And this has been described by other groups as well. Other non-Parkinson's disease medical problems, so heart disease or pain, lack of motivation, which we'll talk more about. And one of the positive things was that people wanted to, felt that exercising would help them to maintain independence. There were social domains to what helped people to exercise or kept them from exercising. So people in general were better if they had a partner to exercise with. Kind of surprisingly to us, people told us that they didn't like exercising in groups, which we found very strange because PD specific groups like Rock Steady Boxing or others are very popular, and in sort of weeding through some of these comments, they have found that it was exactly that people wanted to exercise in a group, but they wanted to exercise in a group of only people with Parkinson's, and that there was significant stigma associated with exercising in a group of people maybe who didn't have symptoms of Parkinson's disease. And then there are environmental factors like, how close are you to a gym? What is your weather like? And those sorts of things. And this translates into sort of the larger conversation about motivating oneself or getting oneself to do these sort of lifestyle type interventions that you can generally refer to as self-care, the things that you can do for yourself to manage your Parkinson's disease, like diet and stress reduction and sleep and meditation. And these all, we know that these things are good for us, but there are a variety of things like time and access and any number of reasons that we people with or without Parkinson's disease don't do enough of these things. And then there are some very meaningful PD specific limitations. Some of them are physical, so the non-motor or the motor disability of Parkinson's disease obviously can make it more difficult to exercise. Changes in smell and taste might be make it more difficult to introduce specific diet modifications. And then the non-motor symptoms of Parkinson's disease, again coming back to this, are really a challenge to motivation in folks with Parkinson's. So in particular, apathy, and this is the loss of interest or enthusiasm or motivation that can be seen in the cognitive domain. So it's, people are not as interested in new ideas or new things. Emotional, where there's not as much interest in relationships and sort of normal interactions, or behavioral apathy, where people aren't as interested in doing the things they normally like to do, but certainly for engaging in new activities like exercise. And this is highly prevalent. It's at 40 or higher % of people will experience this at some point during their disease. Mood problems are probably even more common in Parkinson's disease. Depression and anxiety are very common and very often observed together, and certainly can make it more difficult to exercise. Cognitive impairment we talked about can be a major challenge. And additionally, people with Parkinson's disease, because of the lack of dopamine and the role of dopamine in reward processing in the brain, people with Parkinson's disease just are differently motivated and respond to reward differently. And so all of these are major challenges to motivation in Parkinson's. So in particular for apathy, it's unfortunately very poorly responsive to medications. Sometimes antidepressants or stimulants are used with varying effect. But some of the things that have been shown to be helpful for apathy are things like keeping a consistent sleep schedule, being aggressive about pursuing physical, social, and cognitive activities, and sort of setting a schedule to do those things, setting personal goals, even writing them down in particular can be helpful to overcome apathy. And getting regular exercise has been shown to improve apathy. So that brings us back to one of my favorite topics of exercise, and then brings us to kind of the last topic I'll talk about is how to if we think about exercise as a medicine, and I want you to think about exercise as a medicine, because just like the other medicines that you take, we have good reason to think that it's very helpful for a variety of different symptoms. How do we as doctors prescribe it so that patients will take it? And this is not in Parkinson's disease. There's just one study that looked at the effect of writing a simple prescription for exercise compared to counseling or education, and saw about a 30-minute increase in exercise per week, which is quite significant. So just sort of taking the step to write the prescription for exercise can be beneficial. And if you look at the example here, I'm sure many of you have gotten a prescription that looks like this, although now we all have electronic prescriptions. But you probably saw a prescription like this. I've certainly written a lot of prescriptions that started with carbidopa, levodopa. I have never written a prescription that says, be sure you get some carbidopa, levodopa. we're quite specific, right? We say you take a particular strength of carbidopa, levodopa, you take a particular dose or intensity, you take it at a certain frequency, and you're going to take it for a certain amount of time, and then we'll check in about how things are going. And that's how we prescribe medication. Whereas for exercise, if your provider is lucky enough to have time to find in a very busy visit to talk to you about it, I'm sure that you may get this. Just be sure you get some exercise. Are you getting some exercise? And that's not really a very useful prescription. And we may need to translate this in the same way, where we make specific recommendations about a type of exercise, a frequency of exercise, an intensity of exercise, and then how long are you going to do this before we check in and sort of see how things are going. And I think that that's a powerful way that we can improve prescribing exercise to our patients. And then we also need to think about the fact that just like your medication regimen changes over the course of disease, most people start with one pill of carbidopa, levodopa 3 times a day, or a dopamine agonist, or so you start with a single drug, but then over the course of disease, you get something to for wearing off, or maybe you take an antidepressant. So you get on a more complicated or a modified regimen. And we need to think about exercise in the same way. Whereas a patient with very early stage Parkinson's disease doesn't have balance problems, we can say, okay, well, go out and do whatever, go run 5 miles or ride a bike, or whatever works for you. Whereas a patient with balance problems or someone who's using a walker isn't going to be able to do that, but we still want to incorporate aerobic exercise. So maybe you're doing a hand bike where you're working your upper body to get an aerobic workout, or aqua aerobics, or those sorts of things. And similarly for strength, where in early stage disease you might go out and actually lift weights, or be doing push-ups or burpees. I hate burpees. In late stage, you're not going to do that, but you can still do resistance bands or hand grips. And so this is just to make the point that we need to tailor the approach to prescribing exercise to a patient's specific set of symptoms, but also that we have to pay attention over the course of disease to match it to abilities and disabilities. Very briefly, in the COVID area, this has been very tough for people to do the things they normally do. And just as a plug for it, that there are a number of online fitness options for Parkinson's disease, and a couple of different websites here. But if you just Google online Parkinson's disease fitness, you'll find these same things. So the last thing I'll say, just exercise is good for you. We don't know if there's a best exercise, and that's something that people are trying to study. In the meantime, work with your doctor, a physical therapist, and determine the right prescription for exercise for you. And again, that's going to change over the course of your disease. And really, the best exercise at any given time is the one that you can motivate yourself to do. And then I think I alluded to these questions earlier. So I hope that gives you sort of an overview of what we think are the benefits of exercise. Let me get out of this. I'll stop sharing. And some of the challenges to motivating to do these things. And so I look forward to a discussion with you guys and Mr. Creveling. I don't know if we want to start out with him. John, if you would like to talk about, you have always been such an incredible example of how sort of self-agency and self-efficacy and taking an active role in your own treatment can really bring about great outcomes. And I'll share it's a use or an instructive example that when I called John to ask him if he would do this, I couldn't get him because he was on the treadmill. And then right after he got off the phone with me, I think you were getting on a bike or going off to do some sort of exercise. So I just thought that was pretty funny given what I was calling you to ask you to do. So I'd love to hear your thoughts on this.
First and foremost, thank you, Jim, Dr. Morley, for all your advice for the past 10 years plus for me in terms of exercise and the value added of exercise. In my situation, I've been exercising for more than 20 years. So prior to being diagnosed with PD in March 31st of 2009, I've been exercising before that. So my motivation was set in place already. And of course, before anyone starts a exercise program, I would highly recommend they see the doctor first if they haven't done exercise in an extensive manner before. I find tremendous value in exercise, not only, not only physically, mentally as well. So there's a mental feeling that I express to myself inwards, if you will, that encourages me as well. So I'm motivated by myself first and foremost by doing these things. I think that's what Dr. Morley had mentioned about the value is to be motivated by what you're doing. So I find motivation in the exercise I've done. For example, I've exercised with free weights for about 20 years plus again. But I've also reduced my weights because I wanted to get into exercise with a bicycle. And so I have a stationary bike I now use. My next step is to TerraCycle. And so I'm not quite ready for that, but I'm moving forward in that direction. I find tremendous value in talking with someone about exercise, and if they too find value added in the exercise. And not necessarily they have to do the same things, but if you want to, that might be added value too. To do something very similar, and you have a buddy that's supporting you if you're just starting out, for example, you're not very confident in the direction you're going to take with exercise. So there's added value in finding a buddy as well. These are just some of the things that I do. I find added value in celebrating my successes. So I keep a journal of exercising. I just something like this. It's just a journal. So in my journal, I'll have each day of what I'm doing. And so I can see my progress. I think there's added value in that, and you're seeing it as in front of you. And also when you go above what you were doing, I find added value. It just motivates me as well. I think there's added value in rewarding yourself. So sometimes if I set a goal for myself and I achieve that goal naturally, I want to reward myself to encourage me to do more of that. I think time of day is important. I find value in doing it in the morning, maybe first thing. There's value in that, or at the end of the day, but most people may get home at the end of the day and they may not want to do it. So I find I need to determine the best time of day for me. And so that's when I exercise. I keep a record, as I mentioned, the value is, and also if I'm changing my routine, and it's become sometimes a routine is that people don't want to do it. And so you have to be careful there. But I want to sometimes do something quite differently. I want to change. So I'm also exercising different muscles in my body. That's very important. So there's some ideas as well. We've got to talk about anything else you like.
That's amazing. So it sounds like changing it up, so mixing it up so you're not getting too bored.
Yep.
The time of day, so
Yes.
like kind of set, usually for you, it's in the morning, I guess, so that you can take care of it, because if you let it go too late, you might not get it done. And then it sounds like you internally motivate yourself because you're feeling better.
Yeah.
You get this internal sort of sensation to keep going.
Yes.
And then you feel also that the buddy system, so somebody who motivates you, a friend, even if they're doing something different, you check. And do you check in with that person
Yes.
every day, every week? What's your sort of?
I don't, but if you're just starting out in terms of identifying a exercise program for yourself, that would probably be beneficial to every day checking with that person.
Every day.
I don't, because I've been doing so for a long period of time. So I don't need the same motivation as a person just starting out.
And then you also said about writing it down. So
Yes.
sort of documenting it. So you kind of, by seeing it, maybe in writing it, you sort of keep,
Reinforces. That's
it
right.
reinforces it, right? Okay.
Right.
And if you didn't do it, then that you sort of are disappointed that you don't get to write something down. Or do you write it down if you don't do it? Like you say, like I was a bad boy today or something and didn't happen, or what do you write?
You could do that. I don't do that, but you could do that. I can see that being a very valued benefit.
Okay.
So,
And then you treat yourself as well, you said. So
Yes.
what kind of rewards are you giving yourself?
well, I'm a person that likes to have different goals and objectives in mind, so different plans as well. And so when I achieve something, I may decide, for example, I'm learning to play the guitar now. Is there anyone here that plays the guitar? Give me a call and support me. I'm a beginner. And so as beginners, you like to have people that maybe they too can help you in your beginning process. Or maybe they're at the same level you are, and you might be in trouble. So there's things I want to do in life, a celebration of life. I have PD, but PD is not who I am. It doesn't define me. I'm more than that. And so I'm very, my future is, I feel very blessed in who I am. When I was told that I had PD in March 31st of 2009, my first reaction was I laughed. Now I know PD is very serious, trust me, I know that. But I laughed because I was thinking about in my future, I'm going to be riding my motorcycle for another 10 years. And so having PD altered that a little bit, but not too much. I rode for 5 more years after being diagnosed with PD. And it was, by the way, on March 31st of 2009. I thought it was a April Fool's joke. So you have to laugh a lot, obviously. There's value in that too.
And are you, John, involved in a group then at all? Do you use like a support group to help you, or?
But yes, I'm in the support group. My wife and I find tremendous value in the support group. It's a monthly virtual meeting now, and it may not be sometimes you'd like to get together. These are friends of ours, people that we've known for more than 10 years, many of these people. And so you miss them as family. And it'd be nice when we can start going forward and moving beyond the epidemic that we have experienced.
That's amazing. So if you were to come up with your secret sauce, Jim and I have been talking about the secret sauce and what it is that you know, as a Parkinson's patient think is sort of your secret to success. Would you be able to describe that in a couple of words or a couple sentences for me?
Well, again, I think there's value in determining what it is that you want to do. And what would success look like if you decide that you want to have the involvement with a boxing program? And I've done that. I still do that. I have my own box equipment upstairs in my gym, in my man cave, more like it. So I think you have to decide what it is you want to do. And so how are you going to know you're going to be successful? Decide what your goals are going to be as well, so you can determine if that's successful to you, or you alter them if needed be. Maybe you have decide that you want to suddenly tomorrow start boxing, or suddenly tomorrow you're going to use Tai Chi, but you've never learned it before. You haven't done it before. So it would be unrealistic. So set realistic goals for yourself. That would be another added value.
And do you write those down in your journal too when you get a
I
goal?
do.
Okay.
I do, yes.
That's awesome. That's
do.
really special. Well, thank you so much for giving us your thoughts there, and maybe we can get back to Jim for a minute. So, you know, what is it that you see in John that you think has been, you know, made him the most successful, and what have you learned from him?
Yeah, I think it's, you know, it was great to hear you talk about that, John. I think it's sort of the belief in oneself and sort of a just relentlessly positive attitude. That idea that, you know, you may have Parkinson's disease, but I've heard other patients say, you know, I have Parkinson's, but Parkinson's doesn't have me. So this idea that there's something you can do. It's not a passive process, it's an active process. And that John is always looking for something else that he can do to combat his own disease, or something that he can do to help us with research or education or outreach, or that he's always looking for something to do, I think is maybe the underlying theme. Just that idea that, you know, sometimes we'll refer to as sort of self-efficacy, that this idea that, you know, when confronted with a situation, that there's something that you can do. And believing that there's something that you can do is, you know, a long way towards actually doing something, rather than saying, well, I have Parkinson's disease, so what am I going to do about that? So some people's answer to that question is, I'm not going to do nothing. I'm going to, you know, sit in the chair and do nothing because I have Parkinson's. Whereas John's answer is, well, let me find 5 different things to do. It's something that he didn't, you know, mention that I've always thought is really interesting, is that John is a really talented artist and photographer, writes poetry. He mentioned, you know, playing the guitar, right? A lot of these things he didn't do before he had Parkinson's disease. They were sort of things that he started doing. You know, some of them I know are lifelong interests, but, you know, there were a number of things he started doing after being diagnosed with Parkinson's disease. So this idea that, you know, you got to do something.
Yeah, it's interesting you say that, Jim, because I look at the world with awe and wonder. As in this past weekend, my wife and I, as we drove home from visiting our children up north, Philadelphia, there was a beautiful sunset, and I wanted to stop and just take it all in. And so I view everything, the world, like awe and wonder. To me, it's always been that way. I think I was born with predisposed that way, with genes, optimistic, of course. But I just view everything in the world as awe and wonder.
That's awesome. I think a lot of it is this positive attitude, and I think one of the sort of silver linings in some ways of the pandemic, and I know it's been horrific and just, you know, relentless, but it's sort of us all reaching out to each other. And so Jim and I have been talking a little bit about thinking outside the box, and really, I think some of these the Zoom sort of format has let us be able to put things in the chat. And I think we can, you know, if everyone sort of looks through here, you can see just the amazing types of different things. So Tai Chi for some people, a lot of walking that people are doing, PD warriors, you know, boxing, skipping to music, weightlifting, folk dancing. I mean, you know, just sort of the world is your oyster in some ways, and, you know, table tennis. I got to learn more about this TheraCycle. Maybe somebody could teach me about that, but there's, I think, a lot. Other things that people have asked about here in the chat. that I think people have resonated with the sort of taking control of, the situation and trying to, when people feel, and I think this is across disease states, across, many things in life, is when people feel helpless, like they have no ability to affect change, then it really puts them in a negative mindset and really sort of sometimes closes down their ability to do well. But when people feel like they have control over something, and I think, Jim, you really explained, the benefits of exercise very well, talking about, its benefits on cognition, apathy, these non-motor symptoms, also in terms of, how motor symptoms can be. So I think we have, I believe, that we have good evidence that exercise is medicine and that we have a lot of research, but I think then taking it to that next step of how then do you translate people to be successful in whatever, you tell them to do, and to keep it sustaining throughout the course of a long disease, it sort of takes, I think, some out of the box sort of thoughts and how to, I think a lot of it is just going to be learning from each other. And we've spent a lot of time, I think, trying to figure out what the secret sauce is. So I think you guys can type some of the answers to what Jim has talked about here. Some people have written that it needs to be a routine, the same time every day. One of the questions here, Jim, is what type of exercise, the forced exercise paradigms, maybe as I'm going through the chat here, just sort of finding out some of the secrets here from our patients in the chat, you can tell people what the ideal exercise kind of would be for Parkinson's patients, especially because you talked about aerobic. So maybe how much, how intense, and things like that.
Sure. Yeah, I think that we don't have sort of Parkinson specific recommendations. We kind of go with the recommendations for adults that come from the American Heart Association or the American College of Sports Medicine. The general recommendations for that are 3 times a week of 25 minutes or a total of 75 minutes of very vigorous or kind of aerobic exercise. And that would be like running on a treadmill or, swimming laps or, something where there's the heart rate is getting up to maybe 85% of the maximum and you're sweating and you couldn't hold a conversation. Or a total of about 150 minutes of more moderate exercise. So that's kind of brisk walking or the kind of aerobic exercise that you might get with other types of exercise like dance or other fitness classes, things like that. And so a total of 150 minutes, and then combining that in some way with some 2 days a week of resistance training. That being said, I think it's important to think about that. If you can't imagine yourself doing 150 minutes of exercise a week, that doesn't mean you shouldn't start somewhere, because I think a lot of people get caught up in that. I can't possibly do that, so I'm not even going to start. And I, tell patients, getting started is by far and away the hardest part. In terms of in a perfect world, what do I think is the best? I think the best evidence is there for high intensity aerobic exercise. So all of the sort of epidemiologic data points towards aerobic exercises, the things that make a difference in Parkinson's disease risk. There's a really interesting study that came out maybe about a year ago called Sparks 2, where they looked at high intensity treadmill training and compared patients who just sort of did not vigorous exercise versus people who were targeted to get their heart rate up to 65% of the age-related max or the age-predicted maximum versus people who were 85%. So that vigorous exercise category. And so they looked over 6 months, and the people in that vigorous exercise category had no progression of disease. And so the way that they could tell this is these were early patients who weren't on medication. And so over 6 months, they had basically no detectable change on average in their motor function, whereas the people who did even kind of moderate exercise got a little bit worse, and the people who did no exercise got the worst of everybody. So, at least over a short time, vigorous exercise, vigorous aerobic exercise led to limited or no measurable progression, at least in early Parkinson's disease. So I think that is the optimal, and that's why I sort of developed that chart of someone who has balance problems isn't going to get on a treadmill and run 5 miles a day, but they might be able to do aqua aerobics, or they might be able to do a hand bike to get their heart rate up to 85% of maximum. So we have to think about ways to achieve that same sort of exercise tailored to disease, a person's profile of symptoms and their disease stage. But again, anything you can get yourself to do is the best exercise. You know, if you don't feel like you can get out and get vigorous exercise right now, you know, start with just walking, or start with just stretching, or whatever it is, you know, that you can get yourself to do, whatever is motivating.
Yeah. So things that people have said are motivation are pets, it looks like. So dogs, and I know you have one, Jim.
Yeah.
Because we spoke on one of your talks, one of your dog walks, and
my family's out walking them right now.
paying for boxing classes. So sometimes when you put some monetary, you know, sort of, I think people have Pelotons and have paid big money, and they seem to be motivated with knowing that they're spending that much money. So that's great. There's also some questions here in the chat about whether you know, whether certain exercises can stave away the need for Parkinson's medicines. I think Jim and I, you have the same sort of philosophy. I think we believe that exercise is medicine, but we also think that certain Parkinson's medicines are also medicine and important to take so that we can exercise to the fullest. So I mean, it's part and parcel of using the best of the medicines, the best of exercise, the other approaches that we've sometimes talked about on this, but not to avoid medicine at all costs and then try to substitute, because you can actually sometimes injure yourself, or other things can happen if you're avoiding medicine, right? So would that be kind of what you ran to?
Yeah, I think it's a good point. And what I tell patients is that, you know, my job is to give people enough medicine and the right combination of medicines so that they can be active and exercise. Now, I will say, you know, invariably, you know, the patients that I meet who say, you know, I've had Parkinson's for 5, 6, 8 years and I'm on minimal medication and I'm still doing great, without fail, those people are religious exercisers. And so, you know, I think that it does in some way complement your medication. And there is some evidence from functional imaging studies, or, you know, non-invasive studies that can look at chemicals in the brain, that there is dopamine release in the brain in response to exercise, and in the parts of the brain that are involved in Parkinson's disease. And so it really is, we're getting even better and more detailed evidence about how exercise is medication. But your point, Indu, is exactly right, that you shouldn't try to avoid medication to exercise, because that is probably not a safe way to exercise. You want to get your medicines in the right place so that you're functioning as well as you can, so that you can do as much activity as you can tolerate safely.
That's amazing. Yeah, cool. So I think there's a few people writing here in the chat that they've started small. So somebody who's doing 10 minutes of walking at the beginning is now at 35 and feeling stronger. So I think the more you do it, you'll kind of feel the benefits. And as John and Jim here have been saying, is sort of you get this feed forward snowshoeing. That sounds interesting. You won't catch me doing that. I hate the cold. But and then somebody asked here about a comment on whether the impact of sunlight in exercise in the daytime or is nighttime exercise, like timing of day. What's your sense of things? You know, would be the best.
I think I think it's sort of, you know, something that John said is you know, John's more of a morning person, like he's got to get it done and out of the way. Some people may find that, you know, they need to get their to-do list done before they can let themselves sort of, you know, relax and exercise. I'm not aware of anything, you know, about circadian rhythms and being more or less beneficial in terms of sunlight. So I would still sort of default to that, you know, if you're a morning person and you got to get up and at it, then do it in the morning. If you need to get through your day and have exercise be the way that you decompress after the day, then let yourself do that. And maybe some days it's one, maybe some days it's another. It's really sort of, it's very, very individualized, I think.
What I would say just from the wellness, the literature is, you know, probably getting some sunlight early in the day, even if you're sitting outside is a good thing, just so that from the circadian rhythm. It doesn't mean that you necessarily have to walk outside at that time. And then just don't walk too close to when or don't exercise too vigorously, too close to when you're trying to fall asleep, because sometimes it can kind of make you more awake and then kind of be harder to sort of wind down. So I think that would be something. John, did you want to say something? We're almost at the top of the hour, so I wanted to also give you guys both a chance to say something inspirational before we close too. So go ahead, John.
That's what I was going to add, is that if I find out if I exercise at night, I'm not going to get a good night's sleeping. I also want to compliment Dr. Morley. You can understand why I feel blessed. He's the best doctor there is.
You haven't come to LA and met some of the doctors out here. We have a rivalry of our
I don't know. He's pretty good.
I've hired some pretty awesome ones out here.
I don't know. He's pretty good. I'm very blessed though that he's.
That's very sweet. It's always great to see, you know, the sort of camaraderie, and we learn from our patients as well and want to hear more. And I think Jim really would love to hear if people are finding ways that they've really overcome barriers in exercise. And we've had a couple of other talks that I would refer you back to. We've had Giselle Petzinger come on and talk about, benefits from a cellular level in her animal model research. That is just fabulous. And then we've had some amazing physical therapists. So we can link some of the other talks with, the University of Florida physical therapy gang, our physical therapy gang. Becky Farley's come on. So we have about 3 or 4 talks over the last year. So definitely urge you to read a lot of these things. Midnight on a full moon night. That sounds beautiful, actually, at the park. It sounds like that sounds very pretty as a motivating. Want to give you guys a couple of minutes each or a minute each to say something inspirational. Maybe John, we'll start with you just to kind of close us out and lead us into the weekend.
Well, I encourage people to certainly identify what it is that they want to do, number one. Number two is to do it. To find and make the time to set aside that you're going to do it. You decide this is very important to you. It is important to you to do that. As well as the fact, don't forget to support other people and encourage other people to do it. If you find success in something, you might recommend to other people to try it as well. And join them as a buddy as well in this program. And life too. Thank you.
That's lovely. Thank you so much for joining us. And then Jim?
Yeah, I don't know about inspirational. I guess maybe I'll just make one last pitch for sort of exercise as medication. I think, I hope that I provided you with some evidence that, is convincing that, like any medication that you're going to put in your mouth, exercise will improve your motor symptoms. It will probably improve your non-motor symptoms, and it might delay the progression of disease. And unlike lots of medications that we prescribe for people that, we describe, we talk about the cost and the side effects, exercise can cost you nothing if you like to walk. And it's certainly over a lifetime, even a Peloton is probably cheaper than all of the medication that you're going to take over the course of Parkinson's disease. So the cost is really low. And the side effects are that, you look better, you feel better, and you live longer. So I think, it's a pretty easy sell that exercise is medicine, and it's a medicine that we should all be taking, but certainly for people with Parkinson's disease.
Great. Well, that's awesome. I mean, I think it is hard sometimes to just, the hardest thing is just to start. And once you get going, I think that's one of the things that I think for apathy, is so tough, is that, it's just that starting. And I think even when you kind of get derailed a little bit, sort of just restarting can kind of be another barrier. So I think, keep just putting one foot in front of the other. And once you get, a few feet, then, maybe you'll pick up the pace. So I think, just get started. That's often the hardest part of the sort of progression. But I think, for us, we just love seeing some of the patients. And I've had some success stories where I've met a patient who may not have been an exerciser and may have been putting a lot of other things first. And once we give them the diagnosis and they understand the benefits and they really get into a flow, sometimes they look like better than they've ever looked. And other people say, what's your secret? And, this is after getting the diagnosis of Parkinson's. And I've just been so inspired by so many of our patients who've just really, done some amazing things, even from the exercise perspective. So having a partner creates a habit. So yeah, so get out there, find a friend, maybe a neighbor, and go for a walk. I think that's cheap, free, and also will be a social connection for you. So, yes, thank you for all the great ideas. And we'll look forward to hearing from some of you about what's your success stories. You can email the PMD Alliance gang and they'll pass it on to Dr. Morley. And we'll have a recording available for you to send to any of your other friends that you're trying to motivate too. So I'll send it back to you guys, PMD Alliance gang, to wave us out. Thank you.
Thank you so much. We really appreciate it, Dr. Morley and John and Dr. Subramanian. So at this point, if everybody can turn back on your videos, if you don't mind, we would love to see everybody's smiling faces and get an opportunity here to close out our presentation today. We like to see everybody give a wave of gratitude to, of course, our guest speaker, Dr. Morley, and his guest, John, and of course, Dr. Subramanian. Thank you so very much. And we can't wait to see everybody again. So until next time, thank you and have a great day.
Monday will be amazing. We have an awesome speaker on Monday. So we'll see you then.
Oh, fantastic. Great. Thank you. Have a great weekend.
Thank you, guys.